Lake Superior Life Care and Hospice provides compassionate medical care for those facing a life-limiting illness. Hospice services focus on helping patients and families live comfortably for as long as possible. Hospice is a team-oriented approach that includes professional medical, social, emotional, and spiritual support during this difficult time. This educational series will cover a variety of topics related to the various roles of the hospice interdisciplinary team. Spiritual care.
Hi, I'm Chuck Tuman, and I am the Spiritual Care Director at Lake Superior Life Care and Hospice in Marquette, Michigan. People look back over their lives, and number one, when they do that, they don't always feel good about what they see. Spiritual pain deals with spiritual loss. We deal with loss, we deal with grief, we deal with fear, we deal with anger, we deal with all those things that will cause you not to feel good at the moment. The number one issue in spiritual care at the end of life, when people look back over their lives, the number one issue is relationships. And the number one relationship issue we deal with is forgiveness. People thinking, okay, there's some people that I need to get some things right with. And sometimes their terminal diagnosis is 6 months. It's always 6 months or less, but sometimes it's considerably less. And so we have some work to do in a short period of time. Hospice is it's a lifestyle. It's a way of living while you are in the process of making your final journey here on this earth. Hospice care is comfort care. You're not going into a situation where you receive some of the normal medical treatments, but it's comfort care dealing with all phases of your life. Spiritual care, a combination of spiritual care, social work, home care aides, medical care. Hospice care is designed and organized around a team concept. In our particular situation, we have, and this is pretty much standard worldwide, the standards, number one, there are the medical people, such as the registered nurse, who is the primary supervisor on the case. And then there is a social worker, there's a bereavement coordinator, and there's spiritual care. And if people have the need, there's also home care aid. So we coordinate the care within a very short time, in fact, within 5 days or less of a person being admitted. All 5 of those people have to have their plan for treatment filed and documented and turned in so that we know exactly where we're going to go in the direction with this patient. And then as time goes on, we adjust those plans as the patient's condition changes. So it's always a team, and it's always collaboration with each other. Someone will say, hey, I noticed this today, did you notice that? But what each of us notices helps the other one to do his or her work. Spiritual care, one of the first things that we make sure the family understands when we go for what we call our spiritual care assessment, which we have to do within 5 days of a person being admitted into hospice. One of the first things we help them to understand is that the spiritual care team is here not only for the patient, but also for the caregiver and the extended family. So we might spend time with the patient. We might spend a lot of time with the family, but it's we're here to administer to whoever the people are who have a vital role in that person's life. We tell people there's going to be a moment when you take your final breath in this life and you take your next breath in eternity, and our task is to help you make that transition. As a team, we always have a 4-point agenda. We don't always get through with it because people don't always live this long. But the 4 points in the agenda are, number one, when you find out you have a terminal illness, the number one thing we deal with is, who do I have to forgive? Who do I need to forgive? And we deal with forgiveness first, because until you get forgiveness out of the way, then the other stuff gets shortchanged. The second one is, for what am I grateful, and to whom do I need to say thank you? The third one is, who are the people that I need to say I love you? And the fourth one is, to whom do I need to say goodbye? We don't always get through that agenda, but it's always in the back of our minds. And people love it regardless of how far we get down that road.